We are almost ready to begin. तुम्हारी आवाज इको कर रही है, अभी तुम म्यूट कर लो।
मैम एक ही सिस्टम से लॉगिन करिए, अदरवाइज इको होगा।
हाँ, वो प्रॉब्लम हो रही है।
एक सिस्टम से लीव कर दीजिए।
I think it is better now, and we are almost ready to begin. And countdown has been. Hope that everyone has already registered, and we are about to close the link for registration and the workshop survey. If anyone is left, please let me know. For the workshop, the standing instructions for all the students is that they will have to keep their videos on. I want the videos on for all the students. Hello.
All of them are muted, I think so.
Yeah, but at least they can open their videos, no?
Everybody should open your videos. Dr. Rameshwari.
Yes, I'm trying to. Dr. Richa, are you there?
Yes, yes.
Yeah.
Yeah. Can just a second.
Your video is off.
Please turn on your video. So we already have 100 participants. I think rest of the students can watch on YouTube.
Oh, good. The backdrop is very nice.
Thank you.
It's an important topic, soft skill workshop.
I'm handing over the proceedings further, and I'm going to rename her. Just. The moderators for this session would be Dr. Shuchi and Dr. Pramila ma'am. Welcome.
A very good morning to you all. So I would like to first welcome everyone in this workshop. It's my privilege to invite our Honorable Vice Chancellor, Lieutenant General Dr. Bipin Puri sir, for addressing our students. Meet the mind of the patient before delivering treatment for a successful outcome is the main mantra of our dynamic Vice Chancellor sir. So over to Vice Chancellor sir.
Recognize this result.
I think there is some problem with the audio. Dr. Richa?
Audio is not. So voice.
Hello? अच्छा इधर आवाज ही अच्छा चलिए चलिए हाँ हाँ
Good morning, friends.
के काबिल हम ही हैं, बल्कि प्रोफेसर आदमी हैं इसमें। प्रकृति का नियम है। ओके बॉस।
रुक जाओ, अभी मीटिंग चल रही है। अरे ये देखो मेरे जूम को क्या हो गया। जूम की सेटिंग सही करो, मेरे पता कैसी हो गई, मैं देख ही नहीं पा रही हूँ कैसा दिख रहा है मुझे, पता नहीं ऐसा कैसा हो गया मेरी ना।
Thank you so much, sir.
Shuchi, I am running. Let me run the.
Yeah, sure.
I am going to share my screen. एक बार फिर आओ, कहाँ गया? Share screen. पता नहीं something has happened to my Zoom. कहाँ share screen चला गया?
Minimize the window, then you can see. Maybe it's full screen.
कुछ नहीं दिख रहा मेरे स्क्रीन पे। वीडियो तो मैं रन करूं लेकिन शेयर स्क्रीन नहीं दिख रहा मुझे।
मैम आप सेकंड डेस्कटॉप पे चले गए होंगे एप्पल।
हाँ कहीं और चले गए पता नहीं। चलो मैं आउट होकर के दोबारा आती हूँ।
Sure, ma'am.
Ma'am, you are the host, but
तो कोई बात नहीं, को होस्ट है तो चलेगा। I'm so sorry. I have to log out. I can't see anything. इतनी छोटी सी विंडो आ रही है।
now we can see your screen now.
Yes, thank you. Probably you would be able to hear.
As you're all aware that
Yeah.
medicine is an art, its magic and creative ability have long been recognized as residing in the interpersonal relationship between a patient and his physician. The current model of shared decision making and patient-centered communication has evolved a lot in recent times. I think it's very important to understand that communication skills and empathy are integral and are essential attributes in healthcare professionals. And I also believe that effective doctor-patient communication is the central clinical function, and the resultant communication and is the heart and the art of medicine. Now, I want to say a word on empathy. Empathy is something which is so critically important that it finds echoes of another person in yourself. And if you, it's a very interesting acronym, empathy. If you just follow the various alphabets, it says it all. Empathy, E for eye contact, M for muscles of facial expression, P for posture, A for effect, T for tone of voice, H for hearing the whole patient, and Y for response. So if you look at it all in totality, it gives you a holistic package of what is empathy all about. I also sincerely believe that good doctor-patient communication leads to several outcomes which are of hugely important in the healthcare functionality. It also it causes improved patient satisfaction, it results in better adherence to treatment, and, and eventually it leads to decrease in malpractice lawsuits. So I think in all, um, combination of communication and empathy are really so important and integral in our today's times. The students' development, as I said, should be holistic, should include excellent communication, compassion, patience, flexibility, adaptability, emotional stability. And one must try and be proactive. You must imbibe qualities of being ethical and responsible for your actions. Honesty must be evident in your day-to-day dealings, and you must be an effective team player. Work ethics, time management are so important in our day-to-day dealings. Now, these attributes in every medical professional, especially dental students, can be enhanced with effective, dedicated training. I have great pleasure when I notice the Faculty of Dental Sciences of the King George Medical University is organizing the soft skill workshop for communication skill and has been doing this for the last 2 years. They have incorporated theater plays as a teaching tool for sending the message to dental students um, who start their clinical exposure. Communication skill training during the formative years is a positive investment for better future health of the society. As a premier teaching institute, King George Medical University, it is our collective responsibility to inculcate values of humanity, effective communication, and empathy in our students for all around development. These workshops showcase real life scenarios on situations that can go wrong while students interact with patients and how they can be prevented. I am delighted, I'm so pleased to know that during the pandemic times, the Faculty of Dental Sciences has taken this initiative and has arranged this webinar to inculcate values in dental students who are about to embark on their clinical journey. I wish this virtual workshop my very best and hope to see it go onto a larger platform in the times to come. I would like to conclude by um, making a statement. People may forget what you did, but they will never forget how you made them feel. So remember this, ladies and gentlemen, remember this, my young friends, that it's so important that communications and empathy become an integral part of you. Thank you. And Jai Hind.
Over to you. Uh,
Thank you so much, sir, for your valuable words. I would like to invite Professor Chandra, sir, our Dean, to please present the certificate to our VC, sir. Next.
Respected sir, this is a small token of appreciation from the organizing committee of the communication skill workshop. Thank you so much, sir, for your valuable inputs for this workshop.
The certificate of appreciation to the moderators for this session. Professor Pramila Verma, ma'am, and Dr. Shivchi Tripathi. Thank you for making this session presentable. Now for the next session, I request Dr. Umesh Verma and Dr. Richa Khanna to take over and please.
Good morning to all of you. Thank you very much to organizing team comprising Professor Divya Mehrotra ma'am and Dr. Rameshwari Singhal for giving me opportunity to introduce the next speaker for this session. Our respected teacher, academician, clinician, and renowned researchers, Dean Faculty of Dental Sciences, Professor Anil Chandra sir. I welcome to you, sir, in this session. And without wasting the time, I would like to invite Dr. Richa Khanna for the introduction of the Dean, sir. Thank you.
Thank you, Umesh sir. Thank you. So, words would be less to describe Sir, our Dean, Faculty of Dental Sciences, King George's Medical University, Professor Anil Chandra sir. He's virtued by his vision, his support, and leadership. He has been a constant source of support and encouragement to all the faculty members of Faculty of Dental Sciences, KGMU. And his constant support has been behind all such initiatives and workshops like this for our students. We request you, sir, to kindly address our students with your motivating words.
Thank you, Dr. Risha. A very good morning to one and all. First of all, let me congratulate Dr. Rameshwari Singhal and the entire team of speakers, moderators for organizing this online workshop on communication skills in these difficult COVID times. I think it is the second year in a row when we are conducting this workshop, if I'm not wrong. And it's a commendable job which is done by Dr. Rameshwari, Dr. Divya, Dr. Richa, and the entire team of speakers and moderators. Well, there is no doubt that the success in your life depends to a certain extent on your communication skills. Whether be it's your professional life, whether it's your social life or your personal life. For developing an effective communication, there are several aspects of it. I think Honorable Vice Chancellor has explained it in detail. The foremost thing which comes to our mind is one should have the clarity of thoughts. If you are clear in your thoughts, what you are going to communicate, then your communication is going to be 100% successful. Clarity basically implies emphasizing on the specific goal or objective at a time. For example, if you take an example of it, say, I'm going to communicate my presentation on root canal treatment. So unless I'm clear about my basics and concepts of root canal treatment, I will not be able to communicate it to the audience. So that is one aspect. So clarity of thought, what you're going to communicate to the audience is of importance when you talk of communication skills. The second aspect, which we have to keep in mind, is the courtesy. This is an important element of an effective communication. It reflects your nature and your character. Your communication should always be in simple words. That is very important. Apart from so many points which we need to cover, the communication should always be in very, very simple words. Like we all read different textbooks of different authors which have explained the same thing in a very difficult manner. But there is one book where the author explains everything in a very simple manner, and that is loved by all. So communication has to be in a very simple words. Then your body language also counts. That means your smile, your eye contact, your gesture with the audience, and your tone of speaking. That is a very important aspect, how you communicate to your students, to your professional persons, even to your in your personal life. There are other things also which we have to keep in mind, which is the most important thing is, one of the most important thing is listening aspect. Apart from speaking, if we listen to any author or a speaker with full attention, then we are going to communicate the same thing in to the next audience which we are going to do. So these are, I think, some of the very important points which we have to keep in mind when we plan or think of developing any communication skills. I once again congratulate all the team members of this workshop for their contribution and success, and I wish all the best for the workshop. Thank you so much.
Thank you so much, sir, for your words of wisdom. And it is true that the doctors and patient relationship should be at paramount. Thank you so much, sir. Dr. Richard.
Thank you, sir. Thank you, sir, for your kind words.
Please present a token of appreciation to Chandra sir for this address on behalf of the organizing team.
Thank you. Thank you so much. Thank you so much, Dr. Rameshwari, Dr. Richa, Dr. Divya, Dr. Nandlal, Dr. Umesh, and all the faculty members.
Thank you so
Thank
much.
you, sir, for your guidance and your mentorship always. And we look forward to it in future also. And this is the third year that we are conducting this workshop.
Okay, okay. I apologize. I knew, I
No,
thought
sir.
it's a second year. So it's a
No, it
third year.
is
That's it's still a bigger challenge, and you're doing it in the difficult COVID times. That
right.
hats off to your team.
Thank you, sir. It's a teamwork. Everyone has participated equally in making this workshop a success. And I thank each and every one of you for being a part of this team. Thank you. A token of appreciation to the moderators, Professor Umesh Verma, sir, and Dr. Richa Khanna.
Thank
Thank you
you.
for moderating this session. And now, dear students, we would be running a small glimpse through a walkway through the workshops that we had for the last 2 years. We are not able to do it the same way this year, but I hope through these virtual memories, you would be able to relive what we had done in the last 2 years. So I would be playing 2 videos for you. Just bear with me while I change the videos. This was in 2018. Just a second. I need to close the music. Just a second. What happened to it? The wrong page. Is it audible?
Yeah. Now, you can't hear the dialogue.
Is it audible?
No.
So what should we do now?
I think you have not copied the audio file in the folder.
I have. It is in the folder as well. I can play it directly from there also. Let
Play
me
it
do it.
directly. Play it directly.
Yeah, I'll do that. Is it audible now?
No, we can't see. We can't. You have to stop share, again share.
Okay. Shares. Is it audible and visible?
It is visible, but not audible.
Need the volume.
What should I do now?
Make the volume full.
It is full.
Can't hear.
Should I send it across to you, ma'am?
It's a small file, then send it.
Yeah, I will send it. Just a second.
Audible now. Audible now.
It is audible now?
Audible now.
Okay.
Again, not audible.
I think it's because of connectivity.
Send me, I'll play.
Okay.
Till then time you can have the photos running so that student can see the
Yeah.
photos.
Yeah, I'll do that. I'll play the video if it.
We have started sharing.
Is it visible?
No,
Not visible, not audible?
not visible, not audible. Reshare.
Okay, I'll do. नहीं हो पा रहे ना बहुत ही मुश्किल काम है इसको मैनेज बैठिए प्लीज my system has hanged
Because of the video load.
yeah
Can you
and
send it to me?
it is not going through the WhatsApp also. It's a larger file.
So what we can do, proceed with the next program,
Video.
and yeah, and then we can.
Yeah. So for the next session, the system is totally hanged. I will have to restart my system.
Okay. Okay.
Totally
Any?
hanged.
Who is the
Ma'am, you
moderator?
will have to take over till then. Totally
Yes.
hanged.
Okay. So what do we have?
मैं shut down कर रही हूँ. क्यों? हैं?
These are technical glitches and can happen anytime. So technology has advanced, but has made us captive. So we have to surrender in front of technology now. Instead of we commanding the technology is commanding us right now. So can the students have their videos on?
डिग्री पे ये कोल्ड चेन ही नहीं मेंटेन कर पाएंगे
ये पता हो चले कि हैं कि टहलने चले गए हैं
Just to check whether the students are there or not.
सही है मेरे लेक्चर्स में हो चुका है मैंने किसी स्टूडेंट को बुलाया पता लगा है ही नहीं और उसका प्रेजेंट दिख रहा है
So that's a way to keep checking on them whether they are there or not.
हम वेट कर रहे टाइम का प्रीपोन हो रहा शायद
So you are from third year or final year? You can speak. We are in a talking mode right now.
Third year.
Third year. Okay, so you are just going to go into your clinical setup and you need to know how to talk. I'll just share my experience. I was in BDS third year. I was posted in the medicine ward, and the first patient I went to in the ward was an old patient. I went to his bed, and the first sentence, "हाँ बाबा कैसे हो?" मैंने तो बड़े प्यार से बोला, but patient ने, so he didn't want to even answer me. He was so much fed up because in the medicine ward, so many students would have come to him asking the same question, "Baba kaise aaye, kyun hua?" And he was so much fed up with the same question that he didn't even want to answer. So that's what happens to the patients when they are admitted. And now in our ward, I don't know how many students come up for the evening ward round, but there is a ward round in the evening where the students are expected to come and see the patients, talk to the patients, record their history, and know how learn from their seniors how to examine the patient. So not only the outpatient clinic you have to see the patient, but also you have to see the patients in the ward. And my first experience just made me feel that I have to reconsider how to talk to the patient, because I just went to him and asked him, "Baba kaise ho?" and there was just no reply. So now you know that to get a proper reply, you have to frame your question in such a way that you have to develop a sort of feeling, a concern with the patient. Then only he'll answer you. Otherwise, he'll just show he's not bothered to answer you. He knows that you are just a student to record his history, and the doctor who is going to treat is different person. So he didn't even want to answer me anything. Shalin, any of your experience you want to share here?
Because I was a little benefited because I had seen patient interaction at home also. So my father being in same profession, so I do not suffer that much. But definitely in medicine and surgery, especially, this is a very common thing. Patient has been examined by senior residents first, then there are 3 years of JRs, then there are medical interns, then dental interns, and then medical students, and then we come the dental students. So he would have been examined in 2-3 days by at least 50 people. So he gets fed up. He knows you cannot do anything for his treatment, and he knows he's the only the senior boss can command the treatment. Who doesn't actually examine him?
And there is a very known history of surgery department. I hope you all know. Shalin, would you like to elaborate on that? जो यहाँ की proper कहानी है surgery department की. So I'll just, I'm not a very good storyteller, but I would just frame the story. Junior resident 1 went to the patient because the patient was operated for some bowel surgery, and he wanted to know whether the air passage is there or not. So बाबा सब ठीक है, हवा पास हो रही है कि नहीं? JR1 went, हाँ हो रही है. JR2 went again, asked the same question. He said हाँ हो रही है. JR3 went again and asked the same question. हाँ हो रही है. Then SR went. Again he answered yes, हाँ हो रही है. Then when finally some senior person, बाबा हवा पास हो रही है? हाँ भैया सीटी लगवा दो, जब जब हवा पास होएगी सबको पता चल जाएगा.
This is a big problem because the patient has come for treatment basically. Patient has not come for your teaching. But we being teaching institution, we have to console the patient and examine him in such a way so that he feels as if we are his own. That's the only way we can examine.
So are we ready?
Ma'am, ma'am has joined. Can you make a host and enable screen share? Her name could be alphabetically down in the list.
No, I found her. I've made a host. So you need to make me co-host.
Ma'am, you are the co-host automatically.
No, earlier I wasn't, so I'm there. Yes.
Yeah, yeah. Rameshwari ma'am?
Yeah, I'll sharing. Let's see how it goes. Is it visible and audible?
Yes.
Okay, good. Got it. Thank you.
Hello, doctor. Good morning, doctor. Good morning. Doctor, I have problem of back there, doctor. Hello, तुम जानते हो, मैं sorry, doctor. अरे ओ डॉक्टर, अम्मा भाई, तो क्या करें? तुमको नहीं दिखा तो डॉक्टर ने तुम क्या कर बीच में बोल रहे हो? अब तुम्हें क्या दिक्कत है? तुमको आज
If any of the group wants to do any role play, we can do it, Rameshwari.
आज दे रहे हैं, इलाज करना दोबारा से ऐसा नहीं होना चाहिए, ठीक है? बैठो चेयर पे। अरे समझे तुमको? पीडीएस में मोबाइल यूज कर रहे हो? हैं? ये तो मरीज का परेशान हो रहा है और तुम बता रहे हो, डॉक्टर को समझा रहे हो। मोबाइल के हाथ दो पीडीएस। अरे आप नहीं यहाँ पे कैसा बच्चा तुम्हारा? सरकारी में इससे अच्छा नहीं बनता है। सरकारी में इससे अच्छा नहीं बनता है। और ज्यादा अच्छा बनवाना हो तो प्राइवेट में जाओ। कौन है? जानते नहीं हम कौन है?
डाउन हो कौन?
अबे हमें नहीं जानता। ईस्ट साइड कोरिबा, वेस्ट साइड कंडला, नॉर्थ साइड कश्मीर, साउथ साइड कन्याकुमारी, इन सबको मिला के इंडिया बनता। जहाँ का बच्चा बच्चा गन्नू विधायक को जानता है।
So this was the end of screen share for 2019. 2018 के videos भी लगा देते हैं. I think. I hope they are. Is it audible and visible now?
Stop share and share.
Okay.
बताइए। हाँ, दांत लगवाना था डॉक्टर साहब। बुढ़ापे में।
Audible and visible?
दांत कुछ खाते हैं, ऐसे निकल जाते हैं, दबा नहीं पाते हैं। दिक्कत क्या है बाबा आपको वो बताइए। हाँ, दांत लगवाना था डॉक्टर साहब, बहुत दूर से चले आए, दवाई भी नहीं मिली। बुढ़ापे में दांत भी दांत छोड़ रहा है। मुँह बोलिए। हाँ, लगवाना होता तो यहाँ क्यों आते? एक बात पूछना था डॉक्टर साहब। जो भी पूछना है कल आइएगा तो पूछिएगा, आज टाइम नहीं है। अरे सुन लीजिए क्या है। ये कह रहे थे कि हमारी आर्थिक और पारिवारिक स्थिति थोड़ी सी। क्या हम ठीक करें आर्थिक स्थिति आपकी? अब आप जाइए, दूसरे को आने दीजिए, कल आइएगा तो बात करेंगे। बताइए कार्य संख्या भेजो। पता नहीं कैसे कैसे डॉक्टर मिल जाते हैं, बड़े बुजुर्गों से कैसी बात करनी थी नहीं, यहाँ नहीं दिखाएंगे, भगवान ऐसी बीमारी।
वो एक स्टेज लेकर के चल रहे हैं, तो सबसे पहले हमें पेशेंट का कंट्रोल करना होगा है हमारे पास। हैज टू हैव सम कॉन्फिडेंस इन अस। तो हमें उन्हें बहुत ही इमोटिवेटली ट्रीट करना चाहिए। पहले हमें उनका वी शुड मेक श्योर कि वो आराम से सीट होता है एंड प्लीज काम डाउन एंड देन टेल्स ऑल ऑफ हिज प्रॉब्लम्स टू अस।
फर्स्ट थिंग इज बी इम्पैक्टेड। ओके, नेक्स्ट।
ये प्रॉब्लम्स उन्होंने अच्छे से सुनी नहीं, उनको बोलना था कि उनकी फाइनेंशियल और फैमिली स्टेटस अच्छा नहीं है। उनको ये कंसिडर करना चाहिए था कि जो पेशेंट आ रहे हैं वो ट्रीटमेंट किस हिसाब से करवा सकते हैं। वी शुड बी कंसिडर।
सो सेकंड थिंग इज बी पेशेंट।
Okay. No, I think I have a good video of this one. Let me see.
ऑटो रिक्शा भी नहीं मिला, पैदल चले आ रहे। आइए आराम से।
Audible and visible?
नमस्ते, पहचाने दीजिए, आराम से बैठिए, बैठिए, बिल्कुल आराम से बैठिए, बिल्कुल आराम
This
से
is the
बैठिए।
good version, I think.
अरे बहुत दूर से चले आए डॉक्टर साहब, आज ऑटो रिक्शा भी नहीं मिला, पैदल चले आ रहे। थक गए, एक गिलास पानी मिलता आपको नहीं? क्या बताया डॉक्टर साहब, उम्र के साथ साथ जान की जान हो रहा है, कुछ खाना पीना बनता नहीं है, बने दाल में एक दो रोटी सुबह के खा लेते हैं। बुढ़ापे का शरीर है, इसीलिए आपके पास आए थे जांच लगवाने। फिलहाल आप एक बार अपना मुंह खोल दीजिए, इससे हम आपके मुंह का निरीक्षण करना है। आराम से बिल्कुल बैठिए, बिल्कुल आराम से बैठिए, मुंह खोलिए, देखिए बैठिए बस हमने आपके मुंह का केवल निरीक्षण करना है बस। हाँ ठीक, बंद करिए। बहुत परेशानी होती डॉक्टर साहब, बहुत ज़्यादा दिक्कत होती है। तो फिलहाल जी आपके जो दांत नहीं है, उनकी जगह आप पतीसी लगवा लीजिए। तो शुरुआत में थोड़ा बहुत अटपटा लगेगा, थोड़ी दिक्कत होगी, लेकिन धीरे धीरे आप अच्छे से खाना खा सकेंगे। और यही नहीं, आपके दांत भी भरे भरे रहेंगे, बात करने में भी आपको आसानी होगी, और सबसे बड़ी चीज़ ये कि आपके आत्मविश्वास में वृद्धि होगी। तो आप पतीसी लगवा लीजिए, आपकी सारी समस्या का हल हो जाएगा। अरे डॉक्टर साहब, एक बात कहना था, लेकिन संकोच कर रहे हैं। देखिए, आपको अपने चिकित्सक से किसी भी प्रकार का कोई संकोच नहीं करना चाहिए। आपके बेहतर इलाज के लिए हम पूरा प्रयास करेंगे। तो आप जो भी कहना चाहते हैं बिल्कुल निश्चित होकर कहिए, आपकी सारी बात हमारे पास गोपनीय रहे। आप जो भी कहना चाहते हैं कहिए। अरे डॉक्टर साहब, हम होमगार्ड में थे, अबे पिछले साल रिटायरी हुई, अब पेंशन मिलता है। एक बेटी है हमारी, गंभीर रूप से बीमार, इलाज चल रहा उसका, जो पैसा आता है पेंशन का बेटी के इलाज में चला जाता है, थोड़ा बहुत बचता है घर का खर्चा। देखिए, हम आपकी पूरी समस्या समझ गए। हम अपनी तरफ से पूरा प्रयास करेंगे कि आपका इलाज कम से कम खर्चे में हो जाए चाहिए। और आपकी बेटी के बारे में सुनकर आपके ऊपर दया की भावना उत्पन्न होती है। सुखीलाल जी, क्या आपके पास बीपीएल कार्ड है? हाँ, अगर आपके पास बीपीएल कार्ड हो तो आप अपनी बेटी को यहाँ लाकर दिखाइए, आपका दवा बिल्कुल मुफ्त में हो जाएगा, क्योंकि ये सरकारी अस्पताल है। और आपके प्रति हमें पूरा सहानुभूति है कि आप और आपका पूरा परिवार इन कठिन परिस्थितियों से आप लड़ रहे हैं। तो आप परेशान मत होइए, आप पतीसी लगवा लीजिए, कल आ जाइए 9 बजे तक, उसके बाद आपका समस्या हो जाएगा। और अगर आपके पास बीपीएल कार्ड है तो आप एक बार अपने बेटी को यहाँ जरूर लाइए। हाँ, जाएंगे जरूर, ठीक है। बस कह रहे थे 4 दिन की जिंदगी है, जान क्या लगवाएं, लेकिन घर वाले कहने लगे और कमजोर हो जाओगे, तो आ गए। नहीं, लगवा लीजिए, इससे आपको बहुत सारा अच्छा बहुत मेहरबानी, ठीक है। हाँ हाँ, ऐसा डॉक्टर, ठीक है। मिल जाते हैं कहीं से अच्छे डॉक्टर, आजकल ऐसे कहाँ मिलते, भगवान खुद रखते हैं।
I think we are at the end of the time allotted for this filler activity, and we should move on to the next activity. And I would request Dr. Deepti and Dr. Arun to take over for
Okay,
session,
sir.
for the next session.
Thank you, madam. This is a nice presentation of highlights of the previous skill workshop, whatever happened in last years. This time कोरोना काल काफी बदल दिया हमारे प्रेजेंटेशन को, फिर भी आपका प्रयास, आपका एफर्ट जो हम आज इसको प्रेजेंट कर पा रहे हैं इस समय, तो थैंक्स अगेन मैम. नाउ I would like to invite our chairperson, our teacher, BC Rai awardee, national awardee, Pradeep Tandon sir, who is head of Department of Orthodontic, KGMU. Welcome, sir. I invite you to kindly chair the session.
Thank you very much.
Now, another legend of dentistry, I would like to invite Sadab Muhammad sir, who is another crown awardee of our dentistry, Padam Shri awardee, Dr. Sadab Muhammad sir. Sir, welcome you. I invite you to kindly chair the session.
Thank you very much, Dr. Arnesh.
Thank you. Dr. Dipti, please continue.
Yeah. I request Dynamic Professor of the University, Professor Divya Mehrotra Ma'am, Dean Quality Control, KGMU Lucknow, to please deliver lecture on the topic making rapport with the patient to our guests and students. Ma'am, please. Ma'am, Divya ma'am.
हाँ मैं को शेयर स्क्रीन कर रही हूँ.
Yes ma'am, thank you ma'am.
Can you see my screen?
Yes ma'am.
Yes ma'am.
So my talk for today is making rapport with the patients. I told my story of my first experience. So with that, I proceed to my talk here. So when you see your patient or the patient sees you, it's both way interaction. And the first thing that patient sees into you is your body language or your non-verbal communication. So when you're talking about communication, there are two aspects, the non-verbal and the verbal. The non-verbal and the verbal. And in the non-verbal, what you see, what the patient sees in you is your body language. How much open are you to listen to the patient? Are you attentive to the patient or not? Are you busy on your own phone call and not giving any importance to the patient? So what is how better way you are taking the message from the patient? So that's what patient sees into you. How much confidence? So if you're a third year student and you're just going and peeping in patient mouth, patient will come to know that probably I'm the first few patients he's seeing. So that level of confidence, and when the consultant sees the patient, patient feels very happy that seen a person. It's only because with how much of confidence you are going and dealing with the patient. So there are several pictures depicting what are the various ways when the patient sees you. Are you happy doctor, or you're a smiling doctor, or you're irritated doctor and you don't want to listen to him, and even then a patient has to come and disclose or convey his problem to you. So be attentive listener, as Dr. Anil Chandra said. Be open, be empathetic to the patient, and then only you will get the whole bonding with the patient, so that the patient can convey his or her in problems with you. So the non-verbal communication depends on your own personality, how you are presented. You should look like a doctor. Your body posture should be open to listening to the patient. You should be a smiling face rather than being irritated. Don't make laugh on the patient. So don't laugh on the patient. Don't frown on the patients. Your gestures should help the patient to open up. And also you have to maintain a good distance from the patient. Even in COVID times, you know this, it's important. But otherwise also standing a good distance. That means you shouldn't come very close to the patient. The other aspects which are important in the non-verbal behavior, how you sit or stand. So in India, when you see a patient, usually you are standing on your chair and the patient comes to you. But internationally, when you have to see a patient, you go out, you have the patient's file in your hand, you know the patient's name, and you call the patient with his or name, and then make an eye contact, make a welcome gesture that I am waiting for you, or I need to talk to you. So that's how you make your first impact on the patient, that yes, the doctor is attentive, the doctor wants to listen to my problems, and the patient feels comfortable to open up. And when the patient is speaking to you, you have to nod that yes. And it would be even better, whatever patient said, if you can just sum those up and say, acha to aapki ye problems hai. So the patient knows that yes, whatever I said, it has been taken up. So the first thing, when you see a patient, greet the patient. Patient greeting, that means you have to know the patient. You get your OPD ticket, you come to know patient's name. So you can either call the patient with his or her name, or if the patient is in the ward, then also you can have a look at the case sheet and know the name, and calling the patient by his name if the patient is your own age, or if it's a senior person, you can call him Baba, Amma, or Mr. Mrs. Can I have the audience muted? Yes, lot
Yes,
of
ma'am, we
disturbance.
are doing it.
Yes, please. So the first impression matters, because you have made a good rapport. And this is not only with your in a doctor-patient relationship. This is also in your classroom. So if I am talking to you, I can't see you. So that connect is not there. So I have to see you. Then the connect becomes better. I'm not seeing you, I'm just talking to you. That way I'm not very comfortable talking to you, because I don't know how you're taking it. So that if you can see each other's expressions, that brings along the bonding among the two. So if uh, you communicate well, that has shown that it brings about a 22% increase in satisfaction, and that's what you can give to the patient. A good feeling that yes, the doctor is there, and the patient feels comfortable that yes, he is so much attentive, he's taking so much of care, he's giving so much of personal attention, that he is a capable person, and he or she would be able to treat me now. So that um, feeling in the patient is generated because you are communicating well with the patient.
Ma'am, I'm unmuting you. Unmute yourself.
Have I not been audible till now?
No, I didn't do it till then. Now
Okay.
it's okay. Yeah.
Earlier, was I audible earlier?
Yeah, you were audible. I didn't, I told you and then I unmuted all.
Okay. Okay.
Okay. Yeah.
So the second point I wanted to discuss is build a personal connection. So we see a lot of personal connections, and I don't want to talk of those personal connections that the doctor patient relationship sometimes is so personal that it ends up wants to listen. That is a feeling that has to be generated with your patients. Just two examples. First one, a patient comes to your registration counter. The patient is the doctor calls the patient by name. Bharti Shukla, हाँ बताओ क्या तकलीफ है? This is the common practice if you see in your OPD. Bharti Shukla, okay, बताओ क्या तकलीफ है? The patient says got some extractions done week before, but still we have pain. So doctor says, अरे extraction हुआ है तो दर्द तो हो गई ना, दवा खाओ ठीक हो जाएगा. Patient again says बहुत दर्द है, please do something. The doctor feels okay, I have to see. The patient is so insistent. So doctor says, okay, sit. The doctor checks and says, there's nothing. Go back home, do some massage and see me after a week. Now, a different way could be, हाँ माँ नमस्ते, बताओ मैं आपकी क्या मदद कर सकता हूँ? आप पहली बार आए हो क्या यहाँ पे? Patient says, no, I came here. Am I so happy कि डॉक्टर ने एकदम पर्सनल बॉन्डिंग कर लिया मुझसे? No, I came here, got some extractions done earlier, but still I am having some pain. Okay, अम्मा कोई बात नहीं, आ जाओ बैठ जाओ, मुझे अपनी प्रॉब्लम बताओ. बेटा दर्द बहुत है, कुछ तो कर दो. तो डॉक्टर ने बहुत प्यार से कहा, ओके आइए बैठिए यहाँ पे, देखते हैं हम क्या कर सकते हैं आपके लिए. ठीक है, बढ़िया है, हीलिंग अच्छी हो रही है. थोड़ा सा कुछ है यहाँ पे जो कि आपको शायद ये परेशान कर रहा होगा. इसको जो है ये अपने आप ठीक हो जाएगा, नहीं तो मैं थोड़े दिन आप मसाज करो ठीक हो जाएगा. थोड़े दिन तक एक मसाज करना पड़ेगा एंड देन आपको अगर फिर भी तकलीफ रहे तो आप थोड़े दिन आ जाए. सो देयर आर टू डिफरेंट एस्पेक्ट्स. वन इज that you felt irritated, you didn't want to bother see the patient, but compulsively you had to see the patient and you sent the patient with medicines. The other way is you are feeling very concerned about the patient, check, explain, and then suggest your treatment plan to the patient. That's how you build that personal connection. So never ask patient very short answers. Your questions should be open-ended so the patient can explain, can illustrate, can tell the whole series of events which has caused this problem. Just a quick video. So the doctor here is asking open-ended questions, and so that the patient can describe in detail what the problem was.
Video is not audible, Dr. Divya.
Okay. We can't do anything then because the same problem was. And now, okay, we'll not run the video. Then you have to inform the patient that yes, as per your findings, these are the possibilities, and of these possibilities, this is the feature which I feel is the most bothering, and we are attending this problem at first, and then we'll continue. If not, there's no progress in relief, then we'll attempt another. So you are explaining the entire scenario to the patient. So listening, as Dr. Anil Chandra said, is very important. That only will make the patient feel that the doctor is attentive. So you have to show to the patients that you are patient, you are wanting to listen to all the problems, and you are waiting to hear from the patient what all the problems the patient has. So you have to recognize the patient's difficulties, you have to comfort the patient, and then you have to suggest. That's what I need to tell you, that you have to show your concern to the patient that yes, you are attentive. So not only the verbal communication, but before the verbal communication, there is the non-verbal communication, wherein your body posture, your tone, your how you are listening, that is taken up by the patient, and as per how attentive or how welcoming you are appearing to the patient will develop that rapport with you. So once your verbal communication starts, you greet the patient, build a rapport, build a personal connection, ask questions, and then give your views on patient's health. Again, discuss the problem with the patient and patiently answer all the queries. So that is your first meeting with your patient and helps in making your communication stronger. Thank you.
Thank you, ma'am, for your nice presentation. Definitely that will help to our students. And now I request to our chairpersons to please say few words regarding this workshop.
Dr. Pradeep Tandon is there? Or
Yes,
should
sir.
I start? You ask him to say some few words, then I'll say.
Yes, sir. Yes, sir.
I would say that this was a very nice presentation, and Dr. Divya Mehrotra herself is a very good communicator. If you see her body language, if you see her smile, the way she communicates, she herself is an example of a very good communication. I'm thankful everyone for giving me this opportunity to be a part of this session and part of a very good soft skill workshop. Thank you very much.
Thank you, sir.
I'm really, yeah, yes, I'm really grateful to the organizers for this communication skill workshop, and I'm really thankful to Dr. Divya for giving communication components like if the patients come, how you greet, what is the importance of eye contact. And one thing I would like to emphasize that clear-cut communication is very, very important. Like sometimes, for example, in my specialty, if the patient comes for extraction, we do the extraction and say, okay, you remove the cotton pack after going home, irrespective of knowing whether the patient is local or outstation. Sometimes patients come back after 2 days that still the cotton pack is there because he's outstation patient. He reaches home after 2 days. So if you say you remove the cotton packet after 30 minutes or 45 minutes, then it is very good. So the clear-cut communication is very, very important. It really affects your treatment outcome. So by this communication components and all, definitely it would improve the patients and doctor rapport. And I'm really grateful that this kind of the workshop is being organized every year. Thankful Dr. Divya, Dean, quality control and co-persons who is organizing this workshop. Thank you very much.
Thank you, sir. Now I request Dr. Rameshwari ma'am to please present the certificate of participation, certificate of presentation to our speaker, Professor Divya Mehrotra ma'am.
My screen visible?
Yes, ma'am. It's visible.
I would request the chairpersons to please present the certificate of appreciation to Divya ma'am. This is virtually presented. And I would like to request from the organizing team, I request Pradeep Tandon sir to accept a token of appreciation from the organizing team and a token of appreciation to
Thank you very much. Thank you very much.
Thank you very much, Dr. Rameshwari. Thank you very much.
And I would like to appreciate my team as well for moderating this session so well, Dr. Arunesh Tiwari and Dr. Deepti Shastri.
Thank you, ma'am.
Thank you, ma'am.
Thank
Thanks
you.
a lot.
And now for the next session, I invite Dr. Anjani Pathak and Dr. Lakshya Yadav to take over.
Okay, ma'am. Am I audible?
Yes, you are.
Okay. Good morning to all of you. So first, I would like, it's my pleasure to introduce the chairpersons for this session, Professor A.P. Tikku sir, one of the senior most faculty teacher of this university. I welcome Professor A.P. Tikku sir on behalf of this team. Good morning, sir. And I think Chuck sir is not here. He is busy somewhere else. And the speaker for this session is Professor Pavitra Rastogi sir. He's a well-known speaker and he's speaking about exploratory communication skill with the patients. Professor Pavitra Rastogi, please.
Well, thank you, Dr. Anjani. And first of all, I would like to congratulate the organizing team of this workshop of communication skills, and especially Dr. Rameshwari, who is taking this workshop from the last 3 years in the continuation. And so my topic is exploratory communication skills. So nowadays it's a very important and utmost important part of doctor-patient relationship, that the communication skill is very important. And this is a cornerstone of the fruitful treatment of this era. And as we all know that it's an era of evidence-based medicine and evidence-based dentistry. So the communication between a doctor and a patient is very, very important link for the better treatment, better outcome, better prognosis, and for the decrease in litigations. As we all know that this time too many litigations and legal matters are coming, that this type of treatment was not mandatory with me and the doctor did this type of treatment. So the communication is very, very important between the doctor and the patient. I would like to share my screen. Host disabled attendee screen sharing. Dr. Rameshwari.
आपको होस्ट बना रही बॉस, 1 मिनट.
I think I have to just, it's difficult to share the screen. Okay, thank you. But in the meantime, I would like to say that already too many things are described by the
you can share your screen, sir. It is
Thank you. Just wait.
See, you can share now.
अब शेयर होगा बॉस, शेयर करें.
See, is it possible?
Share screen.
There's a green tab down.
I know, but
yeah, now we can see.
Yes, boss. Yes, it's visible, boss. Okay.
It's visible?
Yes, boss. Yes.
Visible. Oh, thank you. So my topic is the exploratory communication skills. What is the need of this communication skill? It's an important. What is the objective? Or what is the aim? Or what is the rationale? Why this is important? This is skill. So I want to say that communication skills are very, very important. First, if you are thinking about Bloom's taxonomy, according to the Bloom's taxonomy, it is clearly there are 3 domains. We all know that the 3 domains, that is the cognitive, which is the knowledge. Second is affective, that is the what is your attitude towards your patient. And the third one is the most important, that is the psychomotor skill. And being a dentist, if you are being a dentist, the psychomotor skill is very, very important because dentistry is an art. We all know that dentistry is an art. So always you have to be increase your knowledge. That means the cognitive domain should be very, very high. Attitude or affective domain, this part, you have to be yourself. You have to incorporate the different types of things. Already Professor Divya Mehrotra told the things. What type of incorporation? You have to incorporate few things in your behavior. Just like first one, you have the capability to listen the patient. The first one is listening. Important thing. First one is listening. आप patient की बात को बहुत ध्यान से सुनिए. Then second is observing. You have to observe. Listening, observing, then speaking. उसके बाद आप कुछ पूछिए. First listen, observe, then speak. Then pathy में, allopathy is an important, same thing. Empathy and sympathy is also very, very important. So you have to be empathize, you have to sympathize with the patient. It's a very important thing. आप उससे प्यार से बात करें. इसलिए आजकल एक और बात, the important thing is ethics. Ethics is what is right, what is wrong, and what is your moral duty. It's your moral duty. If you think what is your moral, so first you have to do the right thing with the patient. So if you do the right thing, that means non-maleficence. आप कोई भी काम गलत नहीं करेंगे. आपके इलाज से पेशेंट को कभी नुकसान नहीं होना चाहिए. This should be the first objective of your treatment modality. Non-maleficence, then beneficence. कोई हार्म नहीं होना चाहिए, फायदा चाहे उसके बाद हो. फर्स्ट आपके ट्रीटमेंट से कोई हार्म नहीं होना चाहिए. So in communication skills, listening, observing is very, very important. And you have to explore this. So the second line is, what is, you have to establish the reason for visit. Why this patient is here? ये मेरे पास क्यों आया है? उसकी cause क्या है? That is, what is the chief complaint? And you have to listen his chief complaint in his words. And you have to focus on that. So first, you should be very critical observer, very critical thinker. You have to listen, then you can establish the reason for visit. अगर डेंटल क्लिनिक में आप बैठे हैं, उसने मुझसे आपसे आके कहा कि मेरे पानी पीते ही ठंडा पानी बहुत लग रहा है, तो आपको रीजन पर देखना होगा कि इज इट फ्रॉम द पल्पाइटिस और फ्रॉम पेरियोडोंटाइटिस. ठंडा पानी लगने के बहुत सारे कारण हो सकते हैं. स्वीट से उसको परेशानी हो रही है. सो फर्स्ट you have to be increase your knowledge, increase your psychomotor skill and your communication skill, then establish a reason for visit. What is the reason why he is here for you? Then patience. Patience isn't very, very important. You should be very patient. तभी आप उसकी बात अच्छे से सुन पाएंगे. You have to observe. You should be very patient. ये नहीं कि पेशेंट आया और आपने उसके सामने उसकी बात सुनने से पहले ही अपना एक कंक्लूजन निकाल दिया. So you should be very patient toward the problems of his or her problem. Patience, be very patient with your patient. What is the view of the patient? What is the view of the patient? आपका patient आपसे क्या चाहता है? You have to explore कि आपका पेशेंट आपसे क्या चाहता है. ये भी आपको जानना बहुत जरूरी है. आप इट्स ओके, योर स्किल शोज कि ये वाला काम. अब बहुत सारे पेशेंट ऐसे आते हैं कि आप उसने आके सबसे पहले कहा कि नहीं साहब मेरे इस वाले दांत में दर्द हो रहा है. तो आप इरिटेट मत होइए, अपने अफेक्टिव डोमेन को बहुत काम में लगा के रखिए. आप उसकी बात को बहुत ध्यान से सुनिए, फिर उसे धीरे से समझाइए कि नहीं, the problem is not from the upper teeth, problem is arising from the lower one, or whatever the problem. After examination, you have to clearly specify what is the problem is initiating, where is the etiology, what is the etiology, actual thing. But you have to be focused on the patient views also. Expose psychosocial reasons. This is very important with the geriatric patients. You have to think about what is the psychological condition of this patient at this time when he or she is here at your dental chair. What is the psychosocial reasons? What is the problems he is suffering from the last few days or few months or for few years? And what is these conditions are creating what problems in his body and his mental attitude? So be very patient, be very good listener, be very good observer, be very good critical thinker. Then you can be able to explore the psychosocial reasons of the particular, and especially for the geriatric patient. Be very calm, be very patient, be very effective with these patients. नहीं साहब, आप चिंता मत करिए, you are on the right place. आप यहां से ठीक होके ही जाएंगे. तो आपके जो डोमेन है वो बहुत इंपॉर्टेंट है. बी वेरी गुड ऑब्जर्वर, बी वेरी गुड लिसनर, then you can be very good observer of the psychosocial reasons. Already Dr. Divya ma'am already told the things about what are the emotional factors. What are the emotional factors he is at this time during pain or discomfort or severe pain or mild pain or moderate pain? That depends. Dental pain may be moderate, mild, or severe. It's very common. So you have to think about the emotional factors also. Then you can be able to become a good doctor. So the first motive, first aim, first objective of yourself to become a good doctor. And you can become a good doctor by these factors. You should be very effective, very effective, very humble, and very affordable to the patient. You should be available, you should be affable, you should be affordable. आप ऐसे भी होने चाहिए, आपके प्रति मरीज के अंदर भी प्यार आना चाहिए. जब आपके अंदर तभी आएगा जब आप उससे प्यार से बात करेंगे. आप उसके लिए अवेलेबल भी होने चाहिए. ये नहीं कि हम तो साहब अवेलेबल ही नहीं हो रहे. आपके पास एक बार चक्कर लगा रहा है, 2 बार चक्कर लगा रहा है, 3 बार चक्कर लगा रहा है, यू आर नॉट अवेलेबल. It's not a good thing. So you should be available. You should be affable. You should be affordable. Then you or we or me or you, we all can become a good doctor. Antecedent treatments. You have to be very specified towards the treatment, what you are going to be. What is the motive of your treatment? What are the earlier treatments he or she already got in this clinic or in the another clinic? It depends. You have to explore what types of treatments, in a dental treatment, what types of earlier treatments he have already performed. You have to explore. So these types of things, you should be very critical thinker. You should be very critical thinker. And in the last, the most important thing, that is the quality of life. Because by your treatment, by your way of the treatment, by your modalities of the treatment, you are going to better his or her quality of life. So this is the ultimate goal of your treatment, that you have to increase or better the quality of the life. So in this, communication skills are very important. These are the milestone of this era. And why these workshops are necessary? Just because in every phase of the life, you can observe there is a decline. There is a decline in the different scenarios. In every field, there is a decline of the morale. So these types of workshops are very, very important for the doctor-patient relationship, or a dentist, a doctor, a physician, and with the patient relationship. So you, in a nutshell, be very good listener, be very good observer, very good critical thinker. Your investigative skill should be very, very important. And if you want to increase your investigative skills, your cognitive domain should be on the top. And as we all know, that head is on the top. And so the cognitive knowledge is very, very important. That is the knowledge. So first of all, increase your knowledge. These specifically for my students, third year, second year, and final year students. Increase your knowledge. And if you want to increase your knowledge, go to the books. Because books are the main things. They can increase your knowledge. So increase your cognitive domain. Increase your affective domain. Change your attitude. Change your attitude towards your patient, towards your teacher. And if I'm a teacher, if I'm a student, change your attitude towards my students, towards my teacher, and towards my patients. So change your attitude. First, increase your knowledge, change your attitude, and strong your psychomotor skills. Because dentist is a artist. you have to work in the oral cavity. So being an artist, strong your all three domains of the Bloom's taxonomy, then you can be good provider of the better treatment and increase the quality of the life. Thank you. Thank you so much.
Thank you, Pavitra Boss, and for enlightening us about the exploratory skills with the communication skills with the patients. It's a very important topic for students as well as for us also. स्पेशली जो आपने तीनों डोमेन्स बताए, और एक सबसे इंपॉर्टेंट जो बात मुझे लगी कि आपने बताया कि किसी भी तरीके से पेशेंट्स को कोई हार्म नहीं होना चाहिए. दैट इज वेरी इंपॉर्टेंट फॉर अस. थैंक यू बॉस. थैंक यू सो मच. नाउ आई थिंक नो वन इज बेटर देन प्रोफेसर AP Tikku sir to say few words on this topic also. Please sir.
Thank you everybody for having me here with you all. Always a pleasure for me to be amongst the students. And my congratulations to the organizers, firstly, for organizing this workshop, which will be definitely extremely beneficial to the students, to the undergraduate students, who are the future of our profession. And we have put in more than 40 years in the profession, and they will put the next 40 years in the profession. My congratulations to Professor Pavitra Rastogi. They are also all my students from undergraduate, and I'm very proud of all of you, Anjani and Pavitra and everybody. And no better reward for a teacher than to see the progress of his students to reach greater heights. And I'm very proud of you all. And my congratulations to Rameshwari and to Divya also for organizing this. See, I firmly have this thing which I tell to all my postgraduates also, and I will tell to you also, that the purpose in life is to be successful, to earn name, fame, and money. And it's not a crime to earn money or name or fame, but it has to be done within certain moral limits and certain, in a circle. We should not step out of line. That is all what we want from you. And as Pavitra has very correctly said in this lecture, that there are, you see, three things important which you must learn and which you must think, that there are three things. There is information, there is knowledge, and there is wisdom, which you have to gather if you have to be successful in life. Information basically comes from Professor Google. That is all. The professor gives you, Google gives you information. You may be well informed, but you may not be knowledgeable. You may not be knowledgeable. Knowledge comes from teachers and from books. Guru deta hai knowledge. Professor Google sirf information deta. So have an open mind, an open heart to gain knowledge. When you are knowledgeable, you are well informed. Definitely you are well informed. But when you are well informed, it is not necessary that you are knowledgeable. And then the third is wisdom. Who will give you wisdom? So nobody will give you wisdom. Wisdom will come with time, with age, with experience, with various things. And, to use the knowledge wisely is wisdom. Basically, what is wisdom? To use your knowledge wisely. If your knowledge which you have gathered, you are knowledgeable, but you are not using it wisely, that's not wisdom. And we all know over the years that any successful person, any successful doctor, to be a successful doctor, to be a good doctor, first of all, you have to be a good human being. Develop the traits of a good human being. Everybody is a good human being in some form or the other, in their own rights, but you have to develop it as a professional, as a medical or a dental professional. There is a different characteristics you must develop. And if you develop those characteristics, you will be successful. I can tell you, I can assure you. And these are, as they say, it is about communication skills. But there is a saying that actions, speak louder than words. Your actions should speak louder than words. And actions are sympathy, empathy, kindness, generosity, honesty towards your patient. These are the features which you have to develop. Once you develop these, You will be successful in life. There is no doubt in my mind. But develop these. If you don't, if you are lacking in some of these, not all of these, some of these people are lacking. And we see today in today's world that students, somewhere you need to develop these sympathy and empathy and kindness and generosity towards your patients and honesty. And that is very important. If you become a good human being, you'll become a good doctor, you'll become a successful doctor. Knowledge and information and knowledge and wisdom are mandatory. They will come with time and with your teachers, the excellent faculties here. Learn whatever you can do here, because once you pass out from here, you will not be learning much. You won't be trained like the way you are trained here. Anything, any mistake you do, your teachers will take care of it, and learn whatever best you can get from your teachers. Thank you, everybody, for having me here with you, and thank you, all the organizers. Bye-bye.
Thank you so much, sir, for your words of wisdom. We all try to imbibe all these words which are told by you. Thank you so much, sir. Thank you, sir.
Thank you. Thank you, Anjali.
Now over to Rameshwari ma'am for distribution of certificates, please, ma'am.
Thank you, sir. And it is always great to hear from you. And I would request you, sir, to please present a token of appreciation to Pavitra, sir, for his talk.
Yes. Very nicely put, Pavitra. You have put your points very nicely. And it
sir,
is
please,
very... Yes, yes.
Sir, please continue.
No, you can. First, we present this to... इसमें लेकिन साइन तो करा देती.
सर हो गए हैं वीसी सर, क्योंकि आउट ऑफ स्टेशन है, उनके नहीं हुए, इसलिए हमने उसको नहीं पुट किया.
चलो कोई बात नहीं.
आज आ जाएंगे, इवनिंग तक हमें मिल जाएंगे.
Okay. That's all right. But it's a very nice, act, this gesture by all of you to have this workshop for the students. It is very much needed, and the children will benefit greatly, immensely from this. All the students, the undergraduates. But keep your mind and heart open. Dentistry is art and science. It is an art, and some people are gifted by God. And those people who are gifted by God, जैसे ना कहते हैं कि आप लोगों ने पता नहीं सुना कि कहा जाता है कि इन डॉक्टर के हाथ में शफा है. मरीज कहता है इस डॉक्टर के हाथ में शफा है. Now what this word shafa, I don't know whether the students have heard or not. It's a Persian word. शफा क्या होती है कि वही इलाज किसी और ने किया, वही इलाज मैंने किया, मेरा इलाज से कामयाबी नहीं मिल रही है, इलाज सक्सेसफुल नहीं हो रहा, लेकिन दूसरे के सेम इलाज सक्सेसफुल हो रहा है, हील कर रहा है. तो वो एक हीलिंग टच है जो भगवान देता है, ऊपर वाला देता है, और सबको नहीं देता. वो किसको देता है हाथ में शफा? डॉक्टर को, जिसको वो देखता है. मैं फिर कह रहा हूँ, ऊपर वाला देखता है कि किसके दिल में एम्पैथी है, सिंपैथी है, काइंडनेस है, जेनरोसिटी है, ऑनेस्टी है, उसको शफा देता है. और जिसके हाथ में शफा होती है उसका हीलिंग टच होता है, उसके छूने से, उसके देखने से मरीज ठीक हो जाता है और कामयाबियों के पीक पे जाएगा वो. तो ये चीजें डेवलप करनी बहुत जरूरी है. हाथ में शफा सबके नहीं आती. All the best to you. Thank you, everybody.
Sir, please accept a token of appreciation from the organizing team. Thank you, sir, for being part of this. And this is, I think, Dr. Chuck is not here. And
उनका भी मुझको दे दो.
Sir, आप ही को दे दिया. And thank you, Anjali, for moderating this session and for being part of the team. It wouldn't be possible without you all. So it's always a teamwork. I always maintain that, and I always say that it's a teamwork.
And this must continue. This workshop should continue always.
Sir, we will try our very best to continue it to our best of efforts.
Thank you. Bye.
Thank you, sir. For the next session, I would like to invite Dr. Rajiv Singh and Dr. Vandana to take over, please.
Thank you, ma'am. Very good afternoon to all. Now we will move to the next session of the workshop. I would like to invite our chairperson of the session, Dr. Puran Chand, Professor and Head Prosthodontics, and Dr. Ranjit Patil, sir. But he is busy in some meetings, so I would request Dr. Puran Chand, sir, please chair the session.
Thank you.
And now I would like to invite our speaker of the session, Dr. Rhythm ma'am. She will talk about the effective closure of dialogue with the patients. Ma'am, please enlighten us with your golden words.
Hello, everybody. Am I audible?
Yes, you are.
Can I start sharing my screen, Dr. Rameshwari?
I've made you a co-host. You can share your screen.
Okay.
I'll stop sharing mine.
Okay.
Yeah.
Can you see my screen?
Yes.
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 Okay. So, very good afternoon, everybody. It's a great pleasure that, first of all, I would like to say that even in these times, COVID era, when face-to-face communication is not possible between the patients and the doctors, or especially the students who are at home, still the team, Dr. Rameshwari, has made this team to guide you all, even through this COVID times, to make you all in stream with the communication skills with the patient, especially. So even the COVID times has not let down the spirit of the team, and we are here to present before you the various aspects of communication skills. And since the morning, we have been listening to very precious words by VC sir, then Chandra sir, Divya ma'am, Dr. Pavitra, and all of them have very precisely and very effectively conveyed their points. And one common point, if everybody has listened to all the talks of the various speakers, one common point which is coming out from each and every session is active listening. That you have to be a very good listener. Then only you can communicate. If you don't listen, and listen bhi is tarah karna hai, not to react, but to understand and then respond accordingly. So one important thing before I start my presentation is that one important thing which I always tell my students when they are dealing with the patients in the dental clinic especially, one important thing is that always you should understand, dear students, that you are treating a patient and not a tooth. Okay, what happens that आपको एक केस अलॉट होता है एंड उस पर एक टूथ नंबर लिखा होता है एंड लिखा होता है कि class 1 caries, class 2 caries. So what generally happens that students, they just concentrate and focus on that particular tooth and that particular problem, and they start working on the tooth. And sometimes the students forget that they are working on a patient and not just a tooth. So you have to treat the patient as a whole. You are treating a patient because आप tooth treat कर रहे हो तो patient का rehabilitation हो रहा है. So always make a rapport with the patient, start listening to the problems of the patient, and then start doing your work. Now coming to my topic, which is the effective closure of the dialogue or the medical interview which was being taking place between the doctor and the patient. Now, by the time of the end of the interview, patient is already with us for a considerable period of time. वो आपके पास बहुत देर से है, वो आपको अपना chief complaint बता चुका है. He has told you his or her medical history, and now it is the time to summarize your findings, and those findings, those summary should be presented before the patient in a clear manner, in a simple language. And a successful end of interview leads to better health outcomes, because जो आप patient को अपने interview के end में बताओगे, that things will go with the patient. वही patient को याद रहते हैं, and वही written instructions या verbal instructions patient follow करेगा कि which pills he has to take, which diagnostic tests he has to further take, like the X-rays or the CT scans or the blood tests, and when he has to come for the follow-up appointments. We have to emphasize all these points at the end of the interview. Now consider a busy morning in your clinic, and variety of patients are there in your clinic. The first patient, which is maybe a new patient, he requires the information on your findings from history and physical examination. He wants answers to questions and what are the various diagnostic and treatment plans which he has to carry out further in the treatment. The second patient is a follow-up patient, and he has to discuss the results of a recent test. And unfortunately, you have discovered a serious disease and you have to deliver this bad news to the patient. So in this second case, जो आपका large part होगा interaction का, it will be around this deliberation of the bad news and making the subsequent plans according to the treatment, the results of your findings. And the third patient is a patient who generally he is not asking for any particular information, but you want to discuss something which the patient is not asking. Like if the patient during history you came to find out that the patient is a cigarette smoker. Okay, now patient is not saying anything regarding that, but you want to emphasize at the end of your interview that he should stop smoking cigarettes, and you want to inform the patient that smoking cigarettes is injurious to his health and what will be the various outcomes on general health and also on the treatment plan. Suppose the patient is has come for implant placement. Now you have to tell the patient that smoking of cigarettes will impede or it will hinder the outcomes of your implant placements also. So these three scenarios were there. First scenario जिसमें patient was asking something जो उसके diagnostic test से related था. Second scenario, when you have to discuss the results of a particular diagnostic test, it may be a bad news, so you have to give a lot of time to that interaction. And thirdly, where something you especially want to confer to the patient at the end of the interview. So at the end of the interview, it is important to assess patient's understanding of the instructions, to give opportunity to the patient to ask questions, and to discuss any follow-up plans if required. Now, starting, how will you do the end of the interview? You have to reflect on the information the patient has given. आपने अभी तक जितनी information patient से ली, mentally you have to reflect on that. You go through your notes, what you have taken while the history taking, and throughout the this thing of interview taking, you have to be empathetic. Empathetic means you have to place yourself in place of the patient. You have to understand the level of pain or discomfort of the patient. And not at any time we should ridicule the patient. What do I mean by this? Sometimes what happens, हमारे पास जो patients आते हैं, all are not from urban background. They are from very different cultures and backgrounds. Sometimes the patient is from rural background. He may not be able to understand your thing in first go. उसको एक बार में समझ में हो सकता है ना आए, या फिर उसका जो बोलने का तरीका होगा अपनी लैंग्वेज में होगा, अपनी वर्नाकुलर लोकल लैंग्वेज होगी, उसके कुछ पर्टिकुलर वर्ड्स पेशेंट्स यूज करते हैं अपने लोकल एरिया के, तो उसको सुन के आपको हंसना नहीं है, ना ही पेशेंट को आपको नीचा दिखाना है या कमेंट देना है कि आपको समझ में क्यों नहीं आ रहा. पेशेंट अगर दोबारा जानना चाह रहा है, यू शुड वेरी पेशेंटली repeat your instructions or repeat whatever the patient is asking. You have to summarize the whole interview to the patient. Now, after you have taken the whole medical history, very patiently try to summarize the whole thing, that you listen, you had come with this chief complaint. Now, according to your chief complaint, what I understand, this is your problem. So for this problem, maybe you should go for these further tests. And for this, we will, according to your diagnostic test or your X-ray report, we will go for these particular treatment plans. If the patient is already carrying some diagnostic tests, you can form a provisional treatment plan chart to the patient, and all this should be in his language, the patient's language. Do not use very technical language for the patient, because the patient will not understand your technical words. He should be able to understand in a clear and simple language. And we should try to be ethical and not to misguide the patient at any cost. We should explain patient's problem and the required treatment. Patient के diagnostic test के हिसाब से जो भी उसका treatment plan हमें समझ में आ रहा है, we have to give a replacement for the tooth in the form of a fixed partial denture or in the form of implant, or we have to do a root canal treatment or aesthetic treatment. All these things should be explained to the patient, and we should always set a realistic goal. पेशेंट के सामने बहुत अनरियलिस्टिक गोल नहीं हमें रखना है. अगर हम बहुत अनरियलिस्टिक गोल रखेंगे, after the treatment patient will not be satisfied with your treatment, and try not to claim any guarantees of the treatment. Okay, because everything does not depend on your treatment. Like sir was saying that many a times, even after you have given a very wonderful treatment, still the treatment is not successful because it is all multifactorial. Many things depend upon the patient compliance and the host response, and these things are not in your hands. Okay, so you should not claim any guarantees of your treatment, because many things, they are governing your treatment, not just your skills. You should answer all patient concerns and queries in simple language. Again, you should tell about the treatment alternatives. Suppose you are going to do class 1 restoration in a patient, you should tell them, see, these are the various restorative materials available. Amalgam is available. Your tooth colored materials are available. These are the pros of this material, cons of this material. These are the advantages, disadvantages of this material. And this is the treatment cost for this treatment and that treatment. Okay, so you have to tell about the other treatment alternatives and the advantages and disadvantages of the various treatment alternatives. Patient may have a preset notion about a treatment or disease. पेशेंट के मन में कई बार पहले से ही कोई एक पर्टिकुलर धारणा बनी होती है किसी ट्रीटमेंट को लेकर. Like sometimes, many a times, especially in the perio department, the patient will come and ask, when we tell the patient that you should go for scaling, the patient will ask, but हमने सुना है कि दांत की सफाई कराने से दांत हिलने लगते हैं. This is a very common question which is being asked by the patient. So we should not just say, nah, ये आपको किसने बोल दिया, ये गलत है, ये नहीं. You should always encourage the patient to ask questions related to any misconception he is having. Okay, and you should always answer the misconception and try to clarify that misconception. Discuss the treatment protocol and appointments as per patient need. The steps of treatment, time required for the treatment should be discussed with the patient. जो भी हमें उसको further appointments देने हैं, it should be given, we should try to do that. Sometimes it is not always possible to keep patients' convenience in mind, especially in government setups. But we should try to prioritize that. We should try to give patients some convenience, like especially when there is a medically compromised patient, like a diabetic patient. हमने जब history में देख लिया, he is a diabetic patient, we should not give him appointment late in the afternoon. We should try to give him an early appointment in the morning. And we should try to give all the instructions. If the patient is diabetic, we have to tell the patient that you have to take your dose, you have to take your breakfast, and then come for the treatment. We should also assess his understanding. जो आपने उसको पूरा 10-15 मिनट 20 मिनट से समझाया, at the end of your interview, you should try and assess कि उसे कितना समझ में आया. For example, अगर आपने उसे ब्रशिंग के बारे में समझाया था या ब्रशिंग टेक्निक डेमोन्स्ट्रेट की थी, then the doctor at the end may ask the patient to show how it has to be done. पेशेंट के हाथ में आप मॉडल एंड ब्रश पकड़ा सकते हो, and you can ask the patient to repeat whatever was demonstrated to him or shown to him, and very politely correct the patient wherever needed. Again, don't mock the patient, don't ridicule the patient, don't be angry with the patient अगर उसे एक बार में समझ में नहीं आया, and very politely you should try to correct the patient that listen, this thing you are not doing correctly, please see it again and try to learn it. And always ask if there is anything else he would like to discuss. The patient should feel free to ask any queries. Patient आपसे डरा हुआ नहीं होना चाहिए कि वो कुछ बोल ही नहीं पा रहा डॉक्टर के सामने, क्योंकि कई बार होता है पेशेंट आपके सामने कुछ बोल ही नहीं पाता है, घर वापस पहुंच के उसके अंदर वो कंफ्यूजन जैसे थे वैसे ही रह जाते हैं. तो अगर उसके अंदर अपने ट्रीटमेंट से रिलेटेड या इंस्ट्रक्शन से रिलेटेड कंफ्यूजन्स रह जाएंगे, तो वो अपना जो उसको करना है, लाइक उसको कितनी बार ब्रश करना है, कैसे ब्रश करना है, कौन सी मेडिसिन कब खानी है, कैसे सब जो उसका पार्ट है वो ठीक से नहीं कर पाएगा, तो इट विल अफेक्ट द पेशेंट कंप्लायंस. एंड द पेशेंट कंप्लायंस अगर ठीक से नहीं होगी, अल्टीमेटली इट विल अफेक्ट योर ट्रीटमेंट ओनली. सो द पेशेंट शुड गो without confusions. As much as possible, you should try to remove all the confusions from the patient's mind. And one more thing, unexpected outcomes may also be discussed. Like in our department, many a times the patients come with a grossly carious tooth, in which the tooth structure loss is already there, a lot of tooth structure loss. And when we are telling the patient that we will save the tooth with the root canal treatment, we have to also tell that vertical root fracture is one of the complications in such cases where already a lot of tooth structure loss is there. So the patient should know that what complications may occur during the treatment. ये नहीं कि अचानक ऐसा हो गया तो पेशेंट के मन से फिर वो विश्वास हट जाता है ट्रीटमेंट से. He will think that this treatment is not good. This treatment मैं दोबारा ये treatment अब नहीं कराऊंगा. Okay. And at the end of your interview, don't try to bring up new topics which are not related to that particular treatment plan which you are discussing with the patient. Don't bring something which is out of the context with the already going history taking or treatment planning. Otherwise, that whole discussion, the patient will get confused. He will have new questions and he will be now like जो उसके मन में एक आपने summarize किया था वो he will get confused and new questions will arise in his mind and he will go with those questions only to his house. All said, जब पेशेंट हमारे पास आता है डेफिनेटली वी टेक अ इन्फॉर्म्ड कंसेंट, पेशेंट का सिग्नेचर भी हो रहा है, बट अपार्ट फ्रॉम ऑल दीज फॉर्मेलिटीज देयर इज अ अनसेट कॉन्ट्रैक्ट developed between the clinician and the patient by the end of the interview. जब तक इंटरव्यू एंड होता है एक बॉन्डिंग बन जाती है पेशेंट की आपके साथ. पेशेंट स्टार्ट्स ट्रस्टिंग यू एंड ही लुक्स फॉरवर्ड टू यू कि ये मेरा इलाज करेंगे. Okay, so patient की इस feeling को we have to keep in mind and we have to respect that patient जो हमें इतना trust दे रहा है, we have to respect that feeling of trust and appreciation the patient is giving to us. And both parties should be clear that दोनों के रोल हैं, डॉक्टर को ट्रीटमेंट देना है एंड पेशेंट को सारे इंस्ट्रक्शन फॉलो करने हैं. So this thing should be clear by the end of the interview. Closure should be such that it reduces uncertainty for both and it should end on a note of collaboration, confidence and partnership. So with this I will end my talk, and like this in this slide he's saying the doctor will see you now. I can't promise that he'll talk to you, but he'll see you. So this was just a joke. We have to talk to the patient. We have to make the patient comfortable. And by the end of the medical interview, we have to keep in mind that the patient is free of confusions and free of fear from the doctor or the treatment. Thank you so much.
Thank you so much, Dr. Ridham, for giving us insight about the effective closure of dialogue with the patients. And we are definitely sure that the students who are listening to this presentation will keep these points in mind while communicating with the patient, and your points will help them develop a very good communication between the patient and the doctors. So now may I request Puran sir to say a few words and summarize the session, please.
Thank you, dear. Thank you. Thank you for calling me. There is a very good effort by the organizing team. Thanks to organizing team and Dr. Divya Malhotra. And again, thanks to Dr. Ridham. She has presented a very good lecture on this topic. No doubt, the communication skill is a very important tool for the success of any treatment. We are dealing with not only a physical problem, with the emotions of the patient also. So we have to prepare yourself to assure the patient that the patient should feel that he or she is in a good hand. And that will come by the communication skill and soft skill. The patient, we are examining the patient, simultaneously the patient also examine to doctor also. जब हम मरीज को देख रहे होते हैं कि मरीज की प्रॉब्लम क्या है, वो उसी के साथ साथ मरीज भी हमको देख रहा होता है कि आप कितने अच्छे डॉक्टर हो. और दैट इज ये इम्पोर्टेंट सिचुएशन टू एश्योर दैट टू डेवलप द faith in patient that he or she is in a good hand and an expert doctor. We have to correlate not only by the physical presence, with mind also, with emotions also, and with sympathy and empathy also. So our goal of the treatment is to satisfy the patient and improve the quality of the life of the patient. Basically, we are the health professional and related to oral cavity. Okay, then this is our prime duty to satisfy the patient the quality. Thank you to the organizer, Dr. Divya Malhotra, Dr. Rhythm, and Dr. Suchi, and all other faculty members who are involving in the organizing the program. And it should be continue time to time in different topic also. We are not only related to treatment, we have to make a good doctor also, good dentist also. Thank you. Thanks to all.
Thank you so much, sir, for your words of wisdom. May I now request Dr. Ameshwari to present the mementos, please?
I would request Pooran sir to please give certificate of appreciation to Dr. Rhythm for the presentation.
Thank you. Thank you. Please accept my request,
Thank you so
Dr.
much.
Rhythm.
Thank you so much, Dr.
And
Ramesh.
congratulations. Congratulations for the good presentation.
Thank you,
Thank
sir.
you.
On behalf of the organizing team, sir, please accept a token of appreciation.
Thank you. Thank you.
And
Thank
a
you.
token of appreciation to the moderators as well, Dr. Rajeev Singh and Dr. Vandana.
Thank you, ma'am.
For the next session, I invite Dr. Vikram Khanna and Dr. Priyanka to please take over and for the next session.
Thank you so much, ma'am, and good afternoon, everyone, and welcome to the session. Now, I would like to invite the chairpersons of this session. First is Professor Nandlal, sir. He is the head of department in the Department of Periodontics, KGMU. Welcome you, sir. Our other chairperson is Professor Shalin Chandra, sir. He is the head of department in the Department of Oral Pathology and Microbiology. I, on the behalf of organizing committee, I welcome you, sir. The speaker for the session is Dr. Richa Khanna. She is an additional professor in the Department of Periodontics, KGMU. Over to you, ma'am. And she will be discussing about the topic, understanding cultural diversity. Please, ma'am.
Yeah, thank you, Priyanka. So is my screen visible to everyone?
Yes, ma'am, it is visible.
So a very good afternoon to everyone, respected faculty members, the organizers, and dear students. The topic for my presentation is understanding cultural diversity in delivering oral health care. So during the day, we have been talking about how to communicate effectively with your patients. What is the good scenario, what is the bad scenario. But this is something, a term which is relatively new for all of us, and that is how to incorporate cultural diversity when you are communicating with your patients. So first, let's see what is culture. So culture can be defined as either it can be your attitude, it can be the beliefs which you follow, the language which we speak, which we communicate with each other, the customs of our families, of our generations, the rituals that we believe in, the behavior that we all present to each other in different relationships, the faith, the religion. It can be our food, our likes and dislikes for food, the art, drama, music. So all these together, they constitute what is called the culture. Now, some common attributes of culture is that it is not innate, it is actually learned. We do not get culture by our inheritance. We usually learn it through our environment. So it takes years to form. So generations over generations, people transfer culture to the younger generations, and this is the way it is taken forward to. Now, culture changes also. It is not a constant thing. One generation may believe something else, the other may believe something else. So a constant change is seen in culture, and therefore it is transmitted across generations. Now, culture also cannot be isolated because a group of people will share common beliefs, and so culture is common to all of them. So it does not belong to a single person. So just knowing about culture, is that enough when we talk of communicating with our patients? No, it is not. So what do we need to know about cultural competence or cultural awarenesses? The first thing is we need to be aware of the different cultures our patients come from. We need to know about exactly, acquire knowledge about their cultural backgrounds. We need to be sensitive about their cultural differences and thereby develop cultural competence, that is abilities to adapt to these cultural differences. So there is a term called cultural sensitivity, that permits us to learn and understand about people who come from a different cultural background than what we come from. So, and thereby after acquiring this knowledge and being sensitive and being knowledgeable about all this, we are able to deliver what is called culturally competent care. And in our context, it is a culturally competent oral health care. So in this context, I would like to say that with every patient, you might not be able to put this objective of one size fits all. This may not work with all the patients. Every patient will be different, and you may need to customize your cultural competent care to every patient. Now the question, knowing about the theoretical concept of cultural competence, the primary objective is how to actually deliver that care. So how to acquire that abilities of being sensitive to cultural background. So it's an ongoing process. And it does not mean that if you know about the cultural competence does not mean that you know about the cultural background of every patient and you are able to deliver care. There's something which is beyond that, and that is what we are going to see in this presentation. So if you want to be culturally competent in your delivery of oral health care, what areas you need to work on? Firstly, on your communication styles, in which style of communication you are actually speaking to your patient. It should be adopted to the patient's level of education, religion, beliefs, attitudes, and whatever components we talked of culture constitutes of. Think just a second. I'll stop share and continue share because there's something. It's visible now?
Yes, it is.
Okay.
It is.
The second area on which which you should work on when you want to be culturally competent is the language barriers. So when people come from different cultural backgrounds, we have barriers in language. That does not mean you always need to learn different languages, but you should talk in a simple, understandable language that is easily, conveyed to your patient. I don't know why the screen sharing is always going. So other areas that you need to work on is you need to know about the customary health beliefs that exists around you. For example, there might be beliefs of, some people like they don't want to go for extractions because they believe that leads to damage to the eye. So there are some health beliefs which may be some sector specific, some individually person specific or group specific. So you need to be aware of these health beliefs. Then customary oral health practices in family. For example, piercing of nose, piercing of skin. There might be some practices which are going on over and above generations in some of the groups. So we need to be aware and sensitive of all these customary health practices in family and being sensitive to it. We might not agree to these practices, but we should be able to tell the patient what are the benefits and harms of practicing these beliefs. The next areas which you should work on is, for example, some people in some families, the level of decision making is not with the individual with whom you are interacting, the one who is your patient. So at that point of time, you would not be able to convey or convince the patient of the oral health care you think of should be conveyed to that patient. So that level of decision making you should understand and actually respect that level of decision making and incorporate in your treatment plan. Then individualistic and collectivism approach. Every family would not be like, as I said, the level of decision making may be at the individual level or it may also be at the collective level. So that also needs to be given respect, due respect. The other area is the personal space, the privacy issue. Some patients might not be very comfortable in your communication. So again, cultural competence involves your sensitivity to respecting the privacy and the personal space of the patient as well. And the gender issues, again, that comes under the personal space and the privacy of the patient. The socio-economic factors, some people may not be very comfortable with their socio-economic backgrounds. So the clinician or the physician communicating with the patient should be sensitive or should actually respect that inferiority or superiority, whatever it is, with the patient while communicating. So it shall also include dealing with special care industry, that is handling patients with disability, because cultural competence will include everything. So all kind of, it's an inclusive, it brings your communication skills, it gives the characteristic of inclusiveness to your communication style. It also includes knowledge of healthcare disparities in patients from different cultural backgrounds. For example, different epidemiological patterns may exist according to different, different areas, different diseases are existing, different demographic patterns are existing. The knowledge of these factors also is included in cultural awareness. So some key points which I would say when you are talking of cultural competences, there might be group diversity, which is often greater within the group diversity, which is often greater than between the group diversity. And as a clinician or physician, when we are communicating, we should always take care of that. There is no cookbook approach. You cannot overgeneralize the way you're communicating with one patient for cultural competence. You cannot adopt the same approach in the other patient, and that is valid for all type of communication over all the presentations which have been taking place since morning. And consider every patient interaction as a cross-cultural encounter, because every patient will be different to you, different from you in respect to attitude, belief, practices, behavior. So the cultural background is different. And consider, if you start considering every patient as a cross-cultural encounter, your communication would be successful. So the take-home messages, it's always remember, it is because we are different that each of us is special in our own sense, and we should respect that. And that is all about, this is what is cultural competence, which we need to take care of.
Thank you, ma'am. Thank you, Richa, ma'am, for such wonderful lecture. I think the topic which is there, that cultural diversity, it is very, very important in the sense that one fit doesn't be good for everybody. So I think that is a key message which you take away to the home and practice using that thing in your mind will definitely boost up your practice and also your rapport to the patients. That was really a nice lecture. I would now like to ask Professor Shalin Chandra sir to say a few words regarding the lecture and the communication skills meeting.
Yeah, thank you. One thing is important in cultural differences, because we belong to a very conservative society. So even in our society, we have different demographics. So different demographics behave in different way to our interaction. So we have to be very careful when interacting with patients, because some people might take very big objection of your touching them also. So we have to be very careful and deal it accordingly. So before touching any patient, it is important to take permission that I'm going to do this, because otherwise the patient can, because nowadays it is time of the consumer forum and all. So patient can take you to court for that. Okay. So you should always take permission of the patient before touching. Okay. So this is very important. Even in, this is true for any culture. Okay, and it's basic courtesy also. So very nice presentation, Richa. Thank you. And thank you for the organizers for inviting me to chair the session.
I think that is a very, very important advice, sir. And even students also take care of this advice, because nowadays, as rightly said by sir, that it is now time for all litigations, and also informed consent and prior approval also is a very important thing nowadays. Now I'll give now if Nanlal sir, if you want to say some few words.
Thank you, Dr. Vikram. First of all, I would like to thank the organizing committee, especially Professor Vidya Barotra, Dr. Rameshwari, Dr. Richa, and all other their colleagues for organizing such a wonderful program. This is, I think, this is the consecutive third year of this program for the communication.
Yes,
And
yes,
they are doing a wonderful job regarding this. I congratulate them once again. And Dr. Richa Khanna, you have presented well about the understanding of the cultural diversity. I agree with Dr. Shaleen that in this field, different kinds of patients are coming from different regions, different cultures, different religions. So one thing I would like to add more, that if you are examining female patient, at least either their relative, their attendants should be present at that time, at that place, or some male patient should be present during the examining any kind of such patients. So once again, thank you for presenting such a program, Richa. Thank you.
Thank you.
Thank you, sir, for your kind words. Rameshwari ma'am.
yeah. I would request the chairpersons to please present a token of appreciation to Dr. Richa Khanna for her presentation.
Thank you, sir. Thank you. Thank you.
Risha, accept this.
Thank you.
Yeah, very nice presentation, Richa. Keep it up.
Thank you.
And on behalf of the organizing committee, please accept a token of appreciation for the chairperson, Professor Nandlal sir.
Thank you, Rameshwari.
And Professor Shaleen sir.
Thank you, Rameshwari, and thank you, the whole team.
And the program would not be complete without the appreciation showed to our team members and moderators, Dr. Vikram Khanna.
Thank you, ma'am.
And Dr. Priyanka. These people are the pillars on which this workshop rests. They work and they help us to do it every year. So thank you for your cooperation and your support always.
Thank you,
For the
ma'am.
next session, I would like to invite Dr. Ami. Dr. Ami Agarwal, are you there?
Yes, ma'am. Yes, ma'am.
And Dr. Gaurav Mishra to please
Yes,
take the program forward.
Very warm welcome to all the participants, and I welcome Dr. Ramashankar sir from Department of Prosthodontics. Sir, kindly grace the chair as chairperson.
Thank you, Dr. Ami.
Gaurav Mishra.
Hello, good afternoon to everyone. Now, I would also like to invite Dr. Vinay Kumar Gupta, Professor and Head Department of Public Health Dentistry, KGMU Lucknow. And luckily, I also congratulate him that because today is his birthday also. So I wish him a very happy and healthy birthday today. And now I will request Dr. Vinay Kumar Gupta sir and Ramashankar sir, please chair this session.
Thank you, Gaurav. Am I audible?
Yes.
Thank you.
बॉस जन्मदिवस की शुभकामनाएं और आपसे निवेदन.
Thank you, Ami. Thank you. Now I invite speaker Dr. Rameshwari Singhal. He's a additional professor in Department of Periodontics, KGMU Lucknow, and a very good friend of mine also, and backbone of this this workshop. And her topic is importance of body language and empathy towards patients. On to you, Dr. Rameshwari, please.
Thank you, Vinay. Happy birthday. And
Thank you,
thank you for such nice words. I think most of it is covered up since the morning, and it would be a brushing up session that I would be taking today. My topic is importance of body language and empathy. Both these things are very, very important when we are dealing with patients. What we speak, how we speak, is important, but how we convey what we speak is even more important. There are 3 levels of communication that we establish with a patient. One is verbal, one is non-verbal, and the third one is symbolic. By verbal, we mean whatever in words we put up to our patient, like intonation of words, sound, and the implication of those words would be the verbal communication that we have with our patient. How those verbal communication is conveyed to the patient through our gestures, movements, postures, how we stand, how we gesticulate, how we look at the patient, how we are communicating in a non-verbal sense is equally important, or I must say it is more important than what we are saying, because our words inform the implication our body language is conveying to the patient. There are ways of speaking the same words. One person can say in a different way, the other person may say in a different way, but how the patient will perceive it will depend on the way we are communicating through our non-verbal gestures, postures, and movements. By symbolic, why is it not moving? It is the implication of our verbal and non-verbal words. Okay, if you tell a patient that you have pain, you can say you have pain, and then you can say in a very nice way, sit down, this is the tooth which is having a problem, and you must be experiencing pain, I have to take it out, and then you say I have to do an extraction, sit down and I will extract the tooth. These are the different ways of communicating. We have to learn to make it palatable to the patient, to make it more empathetic to the patient. Only 7% of the message is conveyed through our words. Words are not only labels, and the listeners put their own meaning to what we are saying. So it is only the 7% part of what we are conveying to the patient is through the words. The other 38% is through paralinguistic things like the accent, the tone, and the modulation with which you put it. If I ask you that why didn't you attend the class? So it is only the words. The 7% is the words, and how I am speaking to you is the 38%, that is the linguistic thing. Okay, and then 55% is my body language, whether I'm tensed, whether I am relaxed, whether you would get that if I put it in your language, if I say why didn't you attend that class, and you want to me to give you that attendance, then it will be conveyed only, how you will approach me will be conveyed through my body language. Whether I'm tense and I'm in an angry posture, you will not approach me at that time. You understand? And if I am in a relaxed posture and I'm saying it in a lighter tone of voice, then you will think that maybe we have a chance to get the attendance if we put our excuse forward. So these 3 components make how we convey our thought process to the patient. Always remember that while you were doing your preclinical work, you were working on mannequins, you were working on models. But once you enter the clinic, you are working with people, and people have emotions. People are not those mannequins that you can manipulate in any way. You cannot put it on the table, leave it, and then do it after some time. They have emotions. You have to take care of those emotions. They are emotional people, and there is a lot of going on in the background that also has to be taken care of before you start doing a patient. So it is not just the physical presence of the patient at that time. It is all the things that he is coming to you with. He might be having financial constraints. He might be having traveling constraints. He might be having emotional constraints. He might be having some psychological trauma in the background. That could all be related to the kind of behavior he might be putting up before you. And you have to deal with it, and you have to convince your patient for your treatment. And because half the process of healing starts on how you deal with the patient. If you convey your treatment in a way that the patient is convinced and is in confident and is in trust with you, then your work is half done. As Teku sir said, that there is shafa in your hands, but that healing touch comes on how you convey that kind of trust with your patient. So it is important to make that trust, and that comes through your body language. The body language comprises of postures and gestures, how you gesticulate, what kind of stance you have while dealing with the patient. You should always have a relaxed and open stance while you deal with patient. By open stance, I mean that you are open to your patient's needs. The patient should feel that the doctor is concentrated on me. His mind is not elsewhere. He's ready to listen to me. He's ready to understand me. So your postures and gestures should convey all those things. You should always make eye contact with the patient. If you're looking here or there, or not directly on the patient, or you are concentrated on your case sheet, that shows that you are not confident. If you cannot make eye contact with the patient will never trust you. So you have to maintain that eye contact. You have to maintain that kind of level of understanding with your patient. When you look at the patient, you have an understanding with the patient. That's why human communication is so important. We have been in lockdown. There has been a lot of traumatic emotional trauma going on in people who haven't moved out of their houses for 3 months because they didn't have contact with anyone. So that kind of contact, that social contact, that kind of feeling of well-being comes from looking at each other, from having contact with each other. So you should always strive to make an eye contact. Be confident enough to look your patient in the eye and to discuss things with your patient.
समझ गए ना, अभी कल परसों डेंटल काउंसिल ऑफ इंडिया का इंस्पेक्शन चल रहा था, पूरे डेंटल फैकल्टी में हमारे विभाग में दिखा। तो मतलब एक मिनट सुबह से लेकर शाम तक मतलब हम किसी में
Yes. Am I what? I think I'm audible. So you should maintain that kind of eye contact. Next is your orientation. How you present to your patient is important. You should have a confident, relaxed, trustworthy stance. If you are fidgeting, if you are moving from one leg to other, if you are not looking at the patient, if you have that dhila dhala approach, that patient will never trust you. Believe me, he will never trust you. You should look the part of a doctor. You should feel the part of a doctor. You should be confident enough to approach your patient, and you should be confident while talking to your patient. Your posture, and that orientation comes from your attire. It comes from a lot of things. It comes from your knowledge. If you are knowledgeable, you will be confident and you will show that. If you are wearing a good attire, if you are in a proper doctorly attire, you will feel confident. If you are coming in chappals and bermudas, you will never confident to deal with the patient. So your attire, your entire mental backup, it all matters while you are oriented. That makes your orientation and that makes you confident. So you should have a confident, relaxed, trustworthy orientation when you are dealing with patients. Then again, presentation is important. How you present yourself to the patient. You should show confidence. You should be not defensive. Like if you tell a patient that your tooth has to be extracted, you have to say it in a casual manner. You don't have to be defensive towards your treatment. You shouldn't be telling the patient that this is so. Or if in a periodontal state we say that these teeth have to be extracted because they have been compromised, there is no bone left, you have to tell the patient about the whole orientation of this thing. That since the bone level has gone down, these are the treatment options that we had. Maybe we would have been able to do that if you would have come to us earlier, but at this moment this is your best option and I think you should take it, and we can give you options after that also. It is not just the end of the word. After your extraction, we have options that will help you in chewing and which will maintain your quality of life. So this kind of non-defensive and a open approach towards treatment is important while you deal with your patient. You should be approachable. If the patient has any queries, you should be able to answer them. You shouldn't be like, this is what I'm telling you and this is what we are going to do. You have to be approachable enough that the patient can put in his queries. अगर हम ऐसा ना करें डॉक्टर साहब, अगर ऐसा हो जाए डॉक्टर साहब, then you should be able to answer कि ये इसके pros and cons ये हैं. अगर ऐसा हम करते हैं तो ये आपको दिक्कत होगी, और अगर हम ऐसा कर रहे हैं तो इससे आपको क्या फायदा होगा. If you deal with it like that, then you are much more in a better position to solve your patient's queries, and he would be more confident in the treatment that you are going to do. You shouldn't be disinterested towards the patient's ailments. You should have that level of interest in the patient, that because the patient who is coming to you, he's in India, what we see in our setup, that the patient comes to us when they have no other option left. They are in so much of pain that they cannot just miss that appointment, and they have to come to the doctor, because without that their work is not going on. So you have to be interested in this thing. You cannot say ki tum pehle kyun nahi hai. You have to understand that there must be limitations because because of which the patient was not able to come. So you have to be interested in the background stories also, and you have to be interested in the treatment that you are planning. Okay, and there should be no dominance. Important part is that you shouldn't be dominant part in the treatment planning phase or in the dealing with the patient. You have to be a partner in that. You have to be approachable enough, you have to be answerable enough, and you have to be, maybe there are certain times when the patient cannot afford. You cannot say that this is the treatment, we are going to put in implants. Maybe your patient can't afford implants. You have to give him other options as well, and you have to be open-minded towards those options also, because you cannot just say ye isse kaam nahi chalega, ye bekar rahega. You cannot do that, because there are various economical and financial constraints that your patient might be having, and you have to be open to that. Okay. And this is very important, especially for the students who are coming to third year. Your look is very important. You cannot come in any attire you feel like to the clinic. Your shoes should be polished, your hair should be clipped, your nails should be clipped, your apron should be pristine white, it should be ironed, it should have no ink marks on it. Like you come, it shouldn't be shabby. You should, for boys, they should be shaped properly, and for girls their hair should be tied properly. You cannot come open hair to the clinic, and you are not going for a ram walk. Understand, you are going for a clinical work in which you are going to deal with patient, and you are going to work on the patient. So there is a difference. In the evening you can attire, you can wear anything you feel like. You can wear heels, you can wear, you can open your hair, you can have that shaggy beard, which is the trend these days. But when you are coming to the clinic, you have to look and feel the part of a doctor, because it's your appearance that gives the first impression to the patient. He should feel confident enough to be treated by you. He should trust you. He should feel that you are a doctor and you are competent. If you are competent enough to take care of yourself, you are competent enough to take care of the patient. If you are not looking the part of, then how will they trust your competency? How will they trust that you will be able to manage their tooth or their ailment? So you have to look the part. Expressions are important. There are patients coming to us who have cancer. They have very foul smell coming from their mouths, but you cannot wrinkle your nose while you are seeing the patient. You can wear a mask, and maybe you can double your mask, but you cannot wrinkle your face in front of the patient. You cannot show your distaste towards the patient. There might be patients who come from a very poor background. They might not be wearing good clothes, they might be having holes in their chappals, but you cannot show it on your expressions that you find it distasteful. You shouldn't be distasteful towards your patient. You should be empathetic. You should be empathetic towards their position, that they have limitations which you don't have. You should feel thankful, but you shouldn't feel distasteful. Okay, so you have to manage your expressions and emotions while you are dealing with your patients. You have to have that blank, happy, and approachable look all the time, irrespective of the kind of patient you are getting. So to sum up the body language, your words and gestures should show concern and care. You should adjust tone, pace, and eye contact and body posture to the needs of the patient. if you are working on a computer screen or on a case sheet or on a chart, you should balance the focus on the patient and the chart and the computer screen. You shouldn't be focused only on the computer while you are doing the patient. You should have that kind of balance when you focus on the patient and when you write down the notes that you are taking up. And respond appropriately to each of patient's concerns or issues. Coming on to empathy, what do we mean by empathy? Empathy is to understand another person's emotions and feelings. And for that, you need to understand your own feelings and emotion, because once you understand your own feelings and emotion, you will understand other person's feelings and emotions better. To support others who are in need of your support. To treat others the way you want to be treated. To make people feel better about them. So it is important to make people feel better about them, and this is how you show an empathetic behavior. By empathy, we mean that we engage patients in a fruitful, futuristic partnership, and you should have a proactive role, and in the sense that you are in charge of their healthcare, so you should take a proactive role, but you should also foster trust and partnership, because that forms the healing approach. So there should be some inputs from your patient, and you have to guide your patient in a very positive manner so that they reach the goal that you want the patient to have. Especially empathetic behavior is required in patients who are terminally ill, like in patients suffering from cancer or AIDS, surgical patients in which you don't have any other option, breaking bad news, like if you tell a young patient that you have to take out all her teeth because she is suffering from aggressive periodontitis, then you have to have that kind of empathy. You should understand what kind of emotional turmoil that patient is going to go through, and you have to arrange for options so that she could have a good quality of life. And patients with disabilities or with special needs, you have to have a different kind of empathetic approach. You have to be extra careful towards their emotions. You have to treat them as if they are your own kin, like how you will treat your parents or your brother or sister in the same kind of situation, how you would like another doctor to be treating your own relatives. That is the way you have to approach a patient. Simple ways to show empathy. I always say jadoo ki chappi, but in COVID times, no. And especially, I am not suggesting any male doctor to go and give a jadoo ki chappi to a young female doctor. That will lead to litigation and a lot of confusion over here. But yeah, by jadoo ki chappi, we mean you should be empathetic enough that you understand and you are concerned about their well-being. Show concern and awareness of feelings. You should show that through sensitivity, through look on your facial expression. Your facial expression should convey what you are feeling about the patient, and it should be empathetic. And you should try to question the patient to understand the background music that is playing on in patient's mind. So you should question the patient to understand the feelings that are going on, because it's just not just the pain the patient is coming to you. The pain may be related to a lot of things, and that is bound to your treatment, because unless you cure the patient, you understand the patient, and you give a holistic approach to the treatment, you will never be able to cure the patient, and you will never be able to foster a long-term relationship with the patient. Most of the students that we have, they always tell us that after one sitting of scaling, the patient doesn't come back. It happens because you have failed to maintain that bond with your patient. You should, in your first sitting, you should strive to form that bond. That is more important than what treatment you are giving to the patient at that time. I understand there is constraints, there are your code requirements and all that, but with that also you should try that while you deal with, even if you are talking to the patient for that 5 minutes, that 5 minutes are very crucial, in the sense you are able to convey your feelings towards the patient in those 5 minutes, and that you should try to convey in a positive manner. So listen carefully to your patients, have an open and caring posture, consider the emotional state of the patient, and always reflect back on feelings. While you talk to the patient, reflect back on the feelings that is going on in the patient mind. He might be having a deep sense of inferiority complex, that he is illiterate, he is poor, and he is coming to you, and you might judge him. So you shouldn't be judgmental towards the patient. You should convey to your patient that you are not judgmental, and you are listening to the patient in a very open and a caring kind of way. The common mistakes that we make while we deal with patient, we are judging or advising the patient. We judge the patient that if दांत वात साफ करता नहीं है इसीलिए इसके दांत खराब हो रहे हैं, या वी आर एडवाइजिंग ऐसे ऐसे किया करो. दिस इज नॉट द वे वी डील विद द पेशेंट. वी शुड हैव द पेशेंट engagement while we do it. If you will do like this will help you, so try to do it like this. And maybe you didn't have time to do this before, but now since, and you maybe you might not be knowing about it, but now since I'm telling you, I think you will be able to do it fully, and that will help you in your future maintenance of the treatment. Stop criticizing and lecturing your patient. You cannot just say कि दिन में 4 बार ब्रश करना चाहिए, इसको 20 मिनट तक ऐसे करो, उसको 10 मिनट तक ऐसे करो. Don't lecture. Try to explain the background behind the treatment, why you are asking the patient, because in dentistry, whatever we do, the maintenance part is always dependent on the patient. And in any specialty of dentistry, if the patient doesn't maintain his oral hygiene, any treatment you do is going to fail. So you have to make patient proactive in the maintenance part. And do not interrupt the patient while he's trying to narrate to you. Maybe an old patient comes to you and he wants to tell you the story. I understand it's very time consuming, and it may be you might not be having that kind of time, but don't interrupt. Try to navigate sometimes, but don't interrupt, and try to listen to the patient. Finally, to summarize, understand patient's perspective, acknowledge patient's accomplishments, express care and concern, maintain a respectful tone, don't make patient uncomfortable by word or deed, and always be respectful for economic, educational, and social limitations of the patient. Thank you.
Thank you, Madam. Rameshwari Madam, thank you. It's a nice presentation. धन्यवाद, शुक्रिया.
Thank you.
मैं रमाशंकर सर और विनय सर से प्रार्थना करूंगा, कोई क्वेश्चन पूछना चाहे तो मैडम से पूछ लें.
नहीं 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 भाई, ठीक है. मैडम ने बहुत अच्छा सब कुछ बता दिया. मैडम ने ऑलरेडी, मैडम इस चीज में वैसे भी परफेक्ट है. बस मैं इतना ही बोलना चाहूंगा कि बॉडी लैंग्वेज में केवल पेशेंट से हमेशा बच्चों से बोलना चाहूंगा, पेशेंट से हमेशा उसके नाम से, जैसे हम केस हिस्ट्री में नाम पूछते हैं तो नाम से हमेशा पुकारा जाए तो एक पर्सनलाइज फील करता है पेशेंट अपने आप में. और दूसरा, पेशेंट से हमेशा पोलाइट होना चाहिए और हमेशा स्माइल देके बात करना चाहिए. और पेशेंट को हमेशा मतलब आई लेवल से बात करें. ऐसा ना हो पेशेंट बैठा हुआ आप खड़े होकर बात कर रहे हैं, तो पेशेंट्स के साथ लेवल शुड बी सेम. और इसमें पेशेंट को हमेशा बोलने का मौका दें और पेशेंट को हमेशा सुनने का मौका दें. तो जिससे कि एक सेज है, कहते हैं स्पीकिंग इज द सिल्वर, देन लिसनिंग इज गोल्ड. तो इसी के साथ मैं और दूसरा भी कहूँगा कि हमेशा पेशेंट के साथ सिंपैथेटिक और एम्पैथी शो करें, जिससे कि पेशेंट और अटेंडेंट जितने भी हैं जो कि हमेशा पेन में आते हैं हमारे क्लिनिक में या हमारे हॉस्पिटल में, तो उनको एक अपनापन फील हो. Thanks for this opportunity to be a chairperson. Thanks to the organizer. Thank you very much.
रमाशंकर निवेदन करूंगा, कुछ कहना चाहेंगे सर?
डॉक्टर रामेश्वरी, वेरी इंपॉर्टेंट.
रमाशंकर सर.
जी. Congratulations, Dr. Rameshwari, very important topics because of body language empathy in our college and universities. Students are very important for student. स्टूडेंट के जो हमारा पेशेंट्स का रिलेशनशिप होता है वो बहुत इम्पोर्टेंट होता है बॉडी लैंग्वेज का. हमारे स्टूडेंट्स होते हैं वो सीखने का, एक लर्निंग का जो पेशेंट से कम्युनिकेशन है, सॉफ्ट स्किल है, वो बहुत जरूरी होता है. तो अभी ये टॉपिक्स जो डॉक्टर रामेश्वरी का बहुत इम्पोर्टेंट है फॉर स्टूडेंट्स के लिए. और Congratulations for all organizing team for this type of topics and workshop. Very, very important.
थैंक यू सर। मैं एक एग्जाम्पल स्टूडेंट्स के लिए देना चाहूंगा। सबको पता होगा मेरे बचपन में मैं किसी रिश्तेदार के यहाँ जाता था तो बच्चा ध्यान नहीं देता है, टेबल पे नाश्ते की प्लेट आती थी, उसमें बहुत तरह के नाश्ते होते थे, गुलाब जामुन, मिठाई, ये वो। तो मैं चाहता हूँ कि बॉडी लैंग्वेज का महत्व क्या होता है। तो मेरी माता जी मुझे दूर से घूर के देखती थी कि मतलब टूटना नहीं है उस पे। ये बॉडी लैंग्वेज, दिस इज बॉडी लैंग्वेज। बॉडी लैंग्वेज वैसे ही है जैसे कहा जाता है कि नुक्ते के फेर से खुदा से जुदा हो जाना। अगर आप ये नुक्ते की कमी हो गई तो आप खुदा से जुदा हो जाएंगे। तो मैं इसी एग्जाम्पल के साथ मैं मैडम का धन्यवाद करूंगा। आगे मैम बढ़िए, आगे जो भी सर्टिफिकेट।
We request sir to present a certificate to the speaker, ma'am, Rameshwari ma'am, for the certificate.
Please, Rameshwari.
Thank you so very much. On behalf of the organizing team, please accept a token of appreciation, the chairpersons, Professor Ramashakar sir,
thank you,
and Dr. Vinay Gupta.
Thank you.
And a token of appreciation to our moderators, Dr. Ami Agarwal and
मैडम मैं और दिव्या मेहरोत्रा मैम, आपका, ऋचा मैम और बाकी सभी आयोजकों का बहुत बहुत धन्यवाद ज्ञापित करना चाहूंगा। शुक्र नीति से 4 लाइन कही गई हैं, उनको यहाँ उद्धृत करना बहुत आवश्यक है। हमारे पास सब चीज की उपलब्धता है, हर चीज। उसमें कहा गया है कि अमंत्रम अक्षरम नास्ति, नास्ति मूलम अनौषधम, अयोग्य पुरुषो नास्ति, योजका दुर्लभ। अर्थात कोई ऐसा अक्षर नहीं है जो जिसमें मंत्र होने की क्षमता नहीं है, कोई ऐसी जड़ नहीं है जिसमें औषधि के गुण नहीं है, कोई ऐसा मनुष्य नहीं है जो योग्य नहीं है। दुर्लभ क्या है? योजक। तो आप लोग वो योजक हैं जिन्होंने ये सारा आयोजन किया, इसी की दुर्लभता है। और आपने इतना अच्छा आयोजन किया, हम लोगों को शिक्षा दी, हम लोगों ने इससे बहुत कुछ सीखा। आपका बहुत 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 धन्यवाद है, अतिशय धन्यवाद। धन्यवाद मैडम।
Thank you. And I would like everyone to please open up their videos so that we can have a screenshot if possible. I don't know. Okay, so moving on to the end, there is a post workshop survey. This is the link. I'm going to put it in the chat box also that you are able to see it properly. And everyone who completes a pre and a post workshop survey would be receiving the certificate. And this survey link would be closed at 2 o'clock. So you have around 35 minutes to fill this survey. Okay. So I'm putting it in the chat box also. Okay, I'll just do that. इसको छोटा कर सकते हैं।
कहाँ पे मैम? सर्वे दिख नहीं रहा है कहीं पे।
बस दे रही हूँ, चैट बॉक्स में डाल दिया है हमने, और हम स्क्रीन भी शेयर कर रहे हैं, स्क्रीन शेयर कर रहे हैं, उस पे भी है। कहाँ गया हमारा स्क्रीन? Is it visible, Amina?
हाँ मैम, दिख रहा है, दिख रहा है।
So I'm just streaming it for another 10 minutes because everyone who is there would be completing the survey. जो चले गए वो चले ही गए। So for the students, it is only for the students, and whoever will finish the post and the pre, both would be receiving the certificates. Hello. मैं बस 5 मिनट में बंद कर रही हूँ। अच्छा मैम, कर रही हूँ, बंद कर रही हूँ। Okay, I think everyone has got the link now, and I'm going to leave the meeting now. Thank you everyone for being part of this amazing journey.
Thank you.
Thank you.
Hello.